We and many others are trying to create a system to prevent child maltreatment in Los Angeles County. You may have heard the phrase both child welfare system and the other phrase child protective services system. We use both of those phrases sometimes interchangeably. They actually mean two different things. Child welfare means attending to the child's well-being and the family's well-being. Child protection means protecting the safety of the child. And the safety of the child is generally assumed to be at risk because of the parents. For babies born in 2006 and 2007, the cumulative risk of being reported with an allegation of child abuse or neglect to our child protection hotline before they entered kindergarten was that 15% of all babies are reported.
Preventing child maltreatment also prevents all other bad outcomes. There's no magic bullet of what you do that prevents children from coming to the child welfare system that's any different than what you're doing to prevent them from going into juvenile justice or having mental health issues or dropping out of school.
We know we have 500 licensed child care providers. What we don't know is, taken together, how much money comes to LA County for subsidized early childhood education, because it flows to individual vendors primarily.
Fundamental to this vision is the recognition that home visiting plays a specific role in supporting families and must be aligned with our other investments, including our own department's county health equity initiatives. The traditional, or what we know as evidence-based home visiting programs, will not work for all families, and we really get to be intentional at how we can best support high-risk women and families with high needs. One of the things we want to highlight is the Department of Mental Health has made a significant contribution of $40 million to the expansion of home visiting in our county.
The Children's Data Network is a data and research collaborative that specializes in the linkage and analysis of administrative records, and specifically to inform children's programs and policies. We start with birth records, and we're able to drop in existing records for those same children. And when arranged chronologically, you can start to better understand the health, well-being, public service interactions, and ultimately the outcomes for those children.
We target a population 0 to 5 using tobacco tax money. Understanding that the fundamental need for these children to be with their parents is so paramount to their long-term trajectories and their outcomes.
Families have to choose and should choose. This is what I want, and this is who I want it from. And so the issue of engaging families and building trusting relationships with families in communities, in local areas, is huge.